Ian, thank you. It's kind of like who followed Babe Ruth in the batting order? I mean, seriously, here's a sports question for you. Everybody, Stephen knows the answer. Who followed Babe Ruth? You, for anybody but Stephen. The answer is not Mickey Mantle. Stephen, who? Oh my goodness. This is Lou Gehrig. Come on. No, the cleanup hitter for the Yankees. That's me. So the so we have something fun to talk about here. And I wasn't going to say this, but your kids mess with you. Your kids always mess. My daughter messed with me tonight. You know, if men are capable of only one motion at a time, my daughter threw something at me tonight. I probably told half the people in the room. I was an intern in 1981 at Valley Medical Center, and the worst rotation of my internship was the neonatal ICU, you know, at a tertiary medical center. And that's when my first daughter was born. And somebody handed me a full 8-pound baby, and I had no idea what to do with this creature. And what I should have said was, Kristen, don't become a mother until you're ready. Don't become a mother until you've finished, lived in the world where you wanted to live, found the man you wanted to partner with, got the education you wanted to have. Or woman? Did I say girl? What did I say? Yeah, well, you know, this is Santa Cruz, Ian. Ian, could you just give me a break? So in any case, she's 35, and 2 hours ago she had a little girl named Lorelei. So, gotta make fun of Scotland, gotta make fun of the Sentinel, Johnny, a little bit, and we'll get through this pretty quickly. But Ian looked at this map and he thought this was the Trump election. He thought this was, you know, kind of the blue. The blue is good in this. This is Santa Cruz. I confess blue is good. Red is not so good. In Scotland, it might be a little bit confused. But this is a map of what? This is from 2015. Anybody? Yeah, somebody knows. Of course, you know what we're going to talk about. This is a map of teen pregnancy. And the variation in teen birth rates in the U.S. From the red to the blue is 3-, 4-, 5-fold difference. And so if you look at this map and if you're a demographer, you think it might be ethnicity. If you're a Obama supporter, you might think it's Medicaid expansion. If you are an economist, you might think it's income. An educationalist, it's different levels of education. It's multifactorial. And in the U.S., the Scots would look at the U.S. and say, you are a melting pot that is unsuccessfully melted. You should be more homogeneous and much purer, like the Scottish blood. But if and this is teen birth rates, a variation from 3.1 per thousand in the best of us to 120 per thousand in the not so good of us. This is what America looks like today from the perspective of teen. And the reason that it's important is that teen pregnancy is not a first generation, it's a multi-generational impact because it obviously perpetuates itself. We know that poverty begets teen pregnancy, which begets poverty, and it's multi-generational. In Scotland, which is a much more homogeneous place, you would think that the teen birth rate would be much more uniform, much like their Brexit anti-vote, which was all blue. But there is no map of Scotland that looks red and blue on teen birth, but it is checkered like the U.S., and the single best predictor of teen pregnancy is poverty, as Ian just said, and it predicts so many of the healthcare determinants. And so even in Scotland, they see but the good news in UK and in the US, teen pregnancy rates, for reasons that are hard to understand, have been falling. You know, they've been falling over the last 2 or 3 decades. And tonight, we're going to have an opportunity to recognize what this community has done, what California has done, and particularly 2 of our organizations. All of us have contributed to the positive trend that we're going to be seeing, but 2 organizations in particular. This is, Jondi, what we saw from the Sentinel in 2010. I don't think we were looking at the full 20-year trends that were already happening in 2010, but we were discouraged about teen pregnancy in 2010. And so here are my 3 trivia questions. What's a lark? Most of you should know what a lark is. I think, can you say that in unison? Long-acting, reversible. Now, they don't use that term. I'll show you what the term they use in Scotland, but that's not. What is 59% according to the Sentinel? Well, okay, I'll show you. And what does this have to do with 10 kindergarten classes? So a lark. The lark use by Allen's organizations increased 35% in 1 year, 38% in Santa Cruz over a 2-year period. And it may be considered cool now. This is what we're hearing from our providers, that 15, 16, 17-year-olds are not coming in asking for birth control pills. They're asking for the cooler form of contraception. And it's called, in Ian, the coil. It's called the coil in Scotland, or some of them are called it. And this is a picture of a lark. It's one of the 2 common, and this is my favorite photo. This is a lark right here, dangling from the provider. Is she in the room? Okay, so this is a lark. This is implanted. This is inserted. The clinicians in the room understand the difference. This is the news that we had this last summer or last October, that uptick in drug use, but we're seeing teen births down 59%. And this was 59% over the prior decade. And this is what the Sentinel reported just last year. What a difference 6 years makes. This is the teen birth rate. I had to show up Ian and I knew what his slides were going to be. The black is the U.S. California has slightly improved. The Alliance has shown from Merced to Monterey to Santa Cruz a decrease. But in the 25-year span of this data, we have seen the teen birth rate drop by 2/3. And a teen birth rate of 46.7 represented 350 births in 1990. This is 100. The difference between 350 and 100 are 10 kindergarten classes of children not born to teen moms today versus 1990. And not that these children won't be born, but they will be born like to my daughter at age 35 and not 18. Thank God. And her name, Gilmore Girls, is Lorelei. I approve of that message. So in any case, I would like to bring up the greatest health plan in the state of California. Ian is not Kaiser. Kaiser's great. It's not Blue Shield. The greatest health plan in California is the Central California Alliance for Health. Highest quality, 350,000 Medi-Cal members, the most financially successful Medi-Cal managed care plan in the history of the state, and our soon-to-be ex-CEO is sitting right there, 2 seats to your right, Ian. But my fellow commissioner is Ryan. And now, so I Googled Ryan, who's going to introduce the 2 winners tonight, and this is what shows up if you do Google Images, Ryan Coonerty. This is what shows up, and they're all very this is really what's there. And Ryan, come up and explain why this photo is in your Google page.
Those are all the same people. I don't know what he's talking about. So let me just say, before I begin, it's been great serving with Larry, and congratulations on your new grandchild. It's been one of the most shocking things of serving with Larry is I found out that when I was a child, my parents hired his then girlfriend to be my babysitter. And Larry would come over, I'm pretty sure uninvited, to our house and hang out with me when me and my sister when we were 5 years old. I've gone to Child Protective Services and filed a claim, but It's a miracle I'm here. They left me in the charge of Larry Dutali as a junior at UCSC. Now it's wonderful to get to serve with him and this group. And so, 2 years ago, I ran for the Board of Supervisors, and I talked about everything I wanted to do for Santa Cruz County. I frankly didn't talk a lot about health policy, healthcare delivery, public health. And then I got elected to the board, and first I met our remarkable health and human services staff who do incredible work. And then I started to meet all of you and your organizations, and it has become the single biggest priority I have on the Board of Supervisors, mostly because of the people in this room, the way that you work together, the way that you are entrepreneurial and innovative, the way that you, and most importantly, the way that you focus and your values are on the people of Santa Cruz County and serving the people of Santa Cruz County better and better, even as the world goes insane around us. You all stay focused on your mission, and it's just been, been the great joy of the last 2 years, frankly, to get to see the work you do and to get to play a small role in setting some policy and supporting policy around it. So thank you to everyone in this room. I don't take the fact that you're all here in the same room together thinking about big trends and then the people on the ground to improve life in our community. I don't take it for granted. And so please just give yourselves a round of applause for your work. So as Larry pointed out, we have seen, as an example of this collaboration, a remarkable drop in teen pregnancy rates. And serving on the Alliance board and seeing the 3 counties, you can see that we are both serving the people of Santa Cruz, but I think we're also serving as a model for the other counties where we can help them as they continue their downward push, and we can still do good work. And tonight we're here to honor two organizations for being champions of health and who have really driven this change by being smart, by being inventive, by being committed to the community. The first group I want to invite up here is Salud para la Gente. And the second group that we want to honor today is Planned Parenthood. And I cannot tell you how much joy it gives me that on a day when the president in secret launched an attack on this organization, that we as a community have chosen to honor them for their work. So please come up. We have small certificates of appreciation from the county, even though your work has been tremendous. And then we also have some recognition from our state elected officials that will be up in just a second to share. And please, if you want.
Hello, I'm Amy McEntee. I'm the Chief Medical Officer at Salud, and we're very excited to accept this and honored. I want to recognize all of our staff that's here. We have our staff from operations, from finance, our grant writer, several of our medical directors, and our nurses, and the whole team has really contributed to improving access, getting funding, and making sure that our programs work. And so I want to appreciate them. I also want to specifically highlight Alicia Potes. She's our physician's assistant who has been delivering care at the Pajaro Valley High for the last 6 years. So she's really worked hard with the students there, with the staff there, and has developed great relationships with all of them. And I think she's had a strong impact on how we've reduced teen pregnancies in that community, and it's been great for all of us. She's puts in a lot of the cool larks, and the teens seek her out for cool care and for advice, and she has a great relationship with all of them. I also want to really recognize our nurses. Salud has only had nurses for the last 3 years, and the 3 nurses that we have here tonight have done an amazing amount of work in the last 3 years, and what they've done around teen pregnancy is really develop systems that allow us to deliver care the day that people walk in wanting like Depo or birth control or Plan B, and that's made a huge improvement in the care that we can deliver. One of the things for us that was most exciting when we heard about this was we had all been working on teen pregnancy for a long time, and when I started at Salud 8.5 years ago, we all saw teen pregnancy as a problem, and we used to talk about it, and it was kind of feeling like this was never going to change, but we continued to work on it, we continued to change how we deliver care, and we were innovative in how we did it. And then when we heard about these results, we were like, wow, you know, when you've got public policy, clinical policy, education, and the healthcare all working together, you can really make an impact on the community, and that was exciting for us. And kind of what we've been talking about with our medical providers is that oftentimes we get really frustrated with dealing with obesity and some of the other chronic diseases, but our hope is that in 10 years, we'll look back and say, wow, we've really innovated, we've changed how we deliver care, and look, we were able to make a big impact on the community. And so it's been inspiring to us to not feel too burnt out, but to keep pushing forward and keep trying to move that needle. And then lastly, we also really want to congratulate Planned Parenthood and thank them for all of the work that they do. Not only do they provide excellent care to the community, they've always been a safe place for people to get care, and they're a place that people are comfortable to get cared. And additionally, I don't know if people realize how important they've been to a lot of medical training. I think most medical students, a lot of our advanced practice clinicians, and many family practice residents rotate through Planned Parenthood and get a lot of their training around family planning and contraception. And when they come to our clinic, they're prepared and they're ready to deliver that care. And that's been a great benefit to all of us. Thank you.
Hi everyone, I'm Eva Monte. I'm the Regional Operations Director with Planned Parenthood at Monte County and Santa Cruz County. And I'm very pleased to be here speaking in front of all of you. Thank you for the wonderful opportunity and for the recognition. I'm very proud of my team at the Watsonville Health Center. They are innovators, they're true leaders for us. And I wanted to tell you a little bit of a story. So in 2013, the Watsonville Center took on a 6-month project to help increase awareness, acceptance, and identify barriers for LARCs. We all know now what a LARC is, such as the IUCs. They were chosen for this project because of their dedication and commitment, and when we looked at our affiliate, which is 34 health centers, we realized the Watsonville Center inserted more LARCs than any of our other centers. So we gave them homework. This project helped inform best practice. It really improved our workflows and really helped us figure out a better way to provide services to patients who were there, they were ready, and they were willing to get a LARC in the moment, and they were good candidates for it. So we figured out a better workflow for that. It also really informed our practice in general, our education materials that we provide, including our education and options counseling. And the other thing that this project really helped us with was look at the tools that we're currently using, tools such as our reproductive life plan, which we like to call an RLP because we love acronyms. So the use of the RLPs really allows for a better conversation with our patients around family planning and in-depth discussions about more effective birth control methods. It really does help us guide this conversation, specifically when we're talking to teens. Now I'd like to tell you a little bit about CDC information. So in 2005, 0.4% of teens accessing services at Title X funded clinics like Planned Parenthood and FQHCs received IUDs and implants. By 2013, that number had jumped to 7.1%. The CDC at that point concluded, you know, we're definitely moving in the right direction, but more work is still needed. I stand here today very proud to share with all of you that at the end of 2016, 30% of teens coming to Planned Parenthood Watsonville are using IUDs and implants. How are we making this possible? Well, we're very enthusiastic about the work, and we're always ready and willing to offer the best birth control method for our patients. We also have flexible systems that really do bend to help meet the patient's needs. And in case you don't know, we have a private teen entrance. That's really helpful. So, on behalf of Planned Parenthood Watsonville, I really do thank you. Thank you, thank you, thank you, Santa Cruz County, for really being part of this process. You guys have really been supportive, and we really do appreciate it. Thank you.
And I want to ask our partners at the state, from Senator Monte's office and Mark Stone's office, to come up and give you guys some additional hardware.
So very quickly, my name is Erica Parker. I'm with Assemblymember Stone's office. My colleague with Senator Monning's office couldn't be here tonight, but I want to extend the gratitude of both, well, the entire California State Legislature, and tell you and your amazing staff, thank you so much for the hard work you do to make sure our youth is empowered and their options in their life are open for their future. So we have co-signed certificates for both of you from Senator Monning and Assemblymember Stone to recognize all the work you've been doing. Thank you so much.
So Larry, you should know, you know this. I'm from Boston. I don't do Yankee trivia. Go Red Sox. I see there's a lot of other Bostonians here. Great, thanks. So I'm the last thing standing between you and your bike rides home. And I just want to say thank you to our speakers. Ian, thank you very much for being here. Really inspiring talk. Thank you. And congratulations once again to our honorees tonight. Just wonderful performance. And so my name is Stephen Gray. I'm the Chief Administrative Officer at Sutter Maternity and Surgery Center and the President of the Board of the Health Improvement Partnership. So I'd like to welcome you all once again, and I see the paparazzi has followed me. Thank you, Shana. Welcome you all once again. Thank you very much for coming out tonight. It's an inspiring crowd to see all these wonderfully talented and passionate people in this room. I have the opportunity to, every month, on a monthly basis, meet with a number of you in this room for the Health Improvement Partnership Council meetings. And just a few weeks back, about 2 months ago on our meeting, we brought to the council the idea of putting together an op-ed in the Sentinel talking about some of the positive things that have happened since the Affordable Care Act went into place and some of the wins that we've had just over the last 2 or 3 years. And the energy in that room was astounding, and it was just one thing after another. The people, I think, Shelley, I think you were one of those scribes, and just, hand cramps and just couldn't write fast enough because of all of the wonderful things that collaboration in this community has brought for us in terms of our healthcare and our health and well-being in this community. So thank you, all of you, for your wonderful work and passion around those things. There's some amazing work going on, and there will continue to be amazing work going on despite some of the headwinds that Ian talked about tonight, and despite some of the things that we have ahead of us that are challenges. We've still got amazing collaboration, and at least I think you've got our new catchphrase, domination by collaboration. I'm inspired to go out and rock some health policy now. This is so cool. I love that phrase, so I'm gonna keep using that. So I think we have so I do want to thank the HIP board. So these are the members of the board of the Health Improvement Partnership. So thank you to all of those members. Elisa had them stand earlier. I won't have you do that again. And thank you once again to our sponsors for tonight's event. Tonight's event would not have been possible without the Hospital Council of Northern and Central California, the Santa Cruz Surgery Center, Dignity Health Dominican Hospital, and Sutter Health Palo Alto Medical Foundation. So thank you to those organizations for helping make tonight possible. Thank you all very much once again. Wonderful event. Elisa and your staff, thank you so much. Ryan, Shelley, Elisa, Wendy, awesome job. Good night.